Life as a junior doctor almost always feels like it's going at double speed. When you're running around the hospital and trying to keep up to date with all of your jobs, it's no wonder that this sometimes feels completely overwhelming. You have busy days, high stress levels, and multiple tasks. And then you add this to the mix.
Hi, my name is Dr. Chantal, and I'm a junior doctor and medical educator working within the NHS. And welcome to the What the Bleep Masterclass. I've taught many medical students during my time as a medical educator, and the thing I found that they find most nerve-wracking is their first on-call commitment. A lot of these nerves aren't worries regarding how they will treat a patient. Many of them are worries about dealing with the unknown, and part of that will be answering a bleep. Answering a bleep is a key part of being a junior doctor and normally comes along when you have a million other things to do. Therefore, having a structure when you answer these bleeps is of vital importance so that you can get the most out of that crucial conversation. In this masterclass, we're going to go through a structure of how to answer a bleep, and that way you'll be far more prepared for your first on-call commitment.
So the aims of this session: 1. Confidence and calm in the unknown. In this session, this will be regarding bleep answering, but we hope these are transferable skills to other clinical scenarios. This will be achieved by going through a structure to answering calls to ensure you get the most out of that brief conversation. And we will also discuss putting this information across in vital moments when you need more senior help or other members of the multidisciplinary team to give advice or come and treat and assess this patient. Well done, Doctor, you've made it. Now's this small, noisy box that rules your life whilst you're in the hospital. Well, not really, but I want you to think about your bleep and what might concern you going forward with dealing with a bleep, and maybe some strong scenarios you've seen of a junior doctor handling unknown bleeps. In part 1 of this session, we're going to go through a few ground rules about bleep answering and also remaining calm. So, ground rules. Bleeps on call are usually baton bleeps, which means they are handed from person to person. They're never usually unmanned unless something's gone wrong, like a sickness. But equally, you might have your ward-based bleep as well. It depends on the hospital and the priorities there. When with you, that bleep is your responsibility. So for example, if things go wrong or you need to change a battery, you need to handle that yourself. Normally you can't ignore a bleep, and the reason I say normally is because there are some scenarios where you might be allowed to ignore that bleep. And normally that's when you're in the middle of treating a patient or performing a procedure. Try and have someone answer, but if they can't, leave it to the end and answer it as soon as you can, maybe making a note of the number for future reference so that you're able to make that call as soon as possible. And finally, alert bleeps sound different and are to be responded to immediately. And alert bleeps are things like major hemorrhages or crash calls. Remaining calm is the more difficult part. This looks different to everyone, whether that's taking a moment to take a deep breath or finding a quiet space to deliver or digest crucial information. Just find what works for you. For me, it's doing a breathing exercise before a stressful situation, such as box breathing.
Now we're going to show you some examples of bleep answering. There will be 2 examples. The first will not use a structure, the second will, and we'll explain that structure before you see the video.
Now, prior to watching example 1, I encourage you to pause this video and think about some ideas to answer the 3 questions below and keep those in mind while watching.
Hello, this is Chantal, the doctor on call. How can I help?
Hi, this is one of the nurses on Ward 2. I am really worried about one of our patients. Can you please review them?
Oh, okay. Why are you worried about them? What seems to be wrong?
They seem really breathless and it's getting worse. I'm worried as their news score is high and their saturations are 88%.
That does sound really worrying. I have a lot of jobs on my list and I need to review a couple of patients, but I'll be there as soon as I can, and we'll treat the patient. So I'll be there soon. Thanks very much. Bye.
So let's take a moment to go through the information we gained in example 1. So we know that the patient is on ward 2. However, that's the only patient details we currently have at the end of this scenario. We also know that the nurse is concerned. We have a breathless patient, we have a high news score, but we don't know the number for this. But we do know that they have low saturations and a number of 88%. So we do have one specific bit of information. Now in part 3, we're going to go through bleep answering in a second example. But prior to showing you that video, we're going to go through a way of structuring your calls. Let's revisit your ideas when you pause the video before example 1 and see if they match up to our suggested structure for answering a bleep. The 5 P's of bleep answering is intended to provide you with a format that allows you to get the most out of the conversation you have over the phone. Number 1 is patient. These are key details such as name, date of birth, location and hospital number if relevant. 2 is presenting complaint. Why are they in hospital? This alongside past medical history will give you some clues to the patient's condition. 3 is problem. What does the caller need? It might be a simple practical task or something more complex. 4 is pressure. How urgent is the problem? And 5 is preparation. What can the caller do for you before you get there or start treating the patient with?
Hello, this is Chantal, the doctor on call.
Hi, this is one of the nurses on ward 2. I am really worried about one of our patients. Can you please review them?
Okay, let's start with a few things. I'm just going to make sure I have my pen and paper with me. I'm going to get logged into my online system, which is just over here. Can you tell me the patient details, please?
Their name is Mary Breeze.
Okay.
Date of birth 16th November 1939 and their hospital number is 12345.
Perfect. I seem to have their details ready here. That's great. So what are they in for? What are they in hospital for?
They are in hospital for community-acquired pneumonia. They have a background of heart failure and hypertension.
Okay. And what seems to be the problem today?
Their breathlessness is getting worse. I don't think their antibiotics are working.
Okay. And how sick do you think the patient is? How urgent do you think this problem is?
Well, their news is 7 and the patient is deteriorating. I am worried as their saturations are 88%.
No, that does sound really worrying. Okay, what I'd like for you to do, I'm on my way, but in the meantime, would you mind putting them on some high flow oxygen, sitting them as upright as they can manage comfortably, and if any more concerns, put out an arrest call, a 2222. Otherwise, I'm on my way.
Okay, doctor, we'll get on with that.
So what information did we gain in example 2 when compared with example 1? So we were able to get the full patient details, name, date of birth, hospital number and ward, their presenting complaint and also a detailed past medical history. We know the problem of increased breathlessness. We also know the nurse feels this is urgent. And finally, we were also able to provide some instructions to the nurse on what to do and also what to do if we're not able to get there quickly enough. And when we put these 2 sets of information side by side from example 1 and example 2, you can see the clear difference.
So, you've answered your bleep, you've assessed your patient in an A to E fashion as you've been trained, and you found that this person needs more senior help than yourself. How are you going to get that senior there? Worse still, how are you going to get your consultant out of bed and to the hospital to assess and treat this patient? This is where the concept of the used car salesman comes in. You need to convince that senior that they need to come and see this patient, and you need to do so in a structured manner. This is called an SBAR handover, and we're going to run through that now.
This is part 4, getting important information across. So let's say you're on the other side and you need to deliver information to a senior. Pause this video and think about the 3 questions below and maybe the structure you can use to achieve those 3 questions. Your SBAR handover is the quickest and most efficient way of selling this patient to your senior. This is made up of situation, so your who, what, where and when headlines, the background for the patient including their past medical history, your assessment, so what do you know or have done so far, and your response, what do you think is happening and what do you need. Now remember, if you need that senior there quickly and they need to come in from home, put that in S so they get there quickly. So this is the summary of what we have gone through in this masterclass. The first thing we've gone through is the importance of structured bleep answering and the 5 Ps method of answering a bleep, which will hopefully provide the structure you need to get the most out of that conversation. We have also gone through SBAR handovers and how useful they are in putting across information to your seniors or other members of the multidisciplinary team, which will hopefully get you help when you need it. Overall, we have given you the strategies to not only get, but also give important details quickly over the phone to manage clinical scenarios appropriately. Thank you so much for watching this What the Bleep masterclass. Hopefully it's equipped you with the tools you need to answer a bleep effectively. As always, if you have any questions, comments, or anything you want to chat about, please get in contact with the links provided and the emails provided in my e-portfolio.